In the sterile corridors of Clinic Zephyr, where fluorescent lights hummed like anxious whispers, Dr. Lyra Ersova navigated the labyrinthine paths with practiced ease. Her eyes scanned the charts clipped to the patient room's doors, each name and diagnosis a fleeting glimpse into lives both fragile and resilient. As she stopped at room 314, her gaze locked onto a young woman's chart, Akira Katsuragi. The words, "prolonged recovery," danced in red ink alongside her name, a stark warning to the attending physicians of potential complications. Dr. Ersova's thoughts lingered on Akira, whose convalescence had been slow and contentious from the start. She entered the room with a quiet knock, as was clinic protocol. The soft beeps and gentle whirs within filled the space, a reassuring melody that underscored the careful balance of life support systems. Akira lay motionless beneath the hospital bed sheet, her face pale but serene in repose. Dr. Ersova approached cautiously, observing the steady rhythm of the ventilator and cardiac monitor. As she began to review Akira's charts and notes, a shiver ran down her spine, not from the sterile environment or clinical jargon, but from an unsettling sense that something was subtly amiss in this quiet room. It wasn't the beeping machines or the faint scent of disinfectant, it was as if the very fabric of time had begun to warp and bend around Akira's recovery. The words on her chart blurred together: recovery rate normal, patient shows signs of accelerated healing. The timeline seemed too neat, almost artificial. Dr. Ersova's eyes narrowed as she turned her attention to the medication schedule, where a single entry caught her eye. Regenerative therapy, dosages adjusted according to proprietary formula. A faint unease crept up her spine like frost on winter glass. Something within Clinic Zephyr was working with Akira in ways Dr. Ersova couldn't quite grasp. She pushed the thought aside, attributing it to exhaustion and overwrought concern for a patient who'd been under her care for months. Still, as she departed room 314, the faint impression lingered, that something fundamental within Clinic Zephyr had shifted, and Akira Katsuragi was now inextricably tied to its altered rhythm.